in my experiences, I often get asked, how do we help people to sit? I can't get them to sit. I ask them to sit, they go, and then they just won't sit. And so a lot of times, what we do is we get them there and down. You're being resisted. You're being resisted. Go ahead and sit. Okay. Ever seen this? Has anybody seen that?
Yeah.
Yeah, we've all seen it. Unfortunately, it happens. How did that feel?
I felt like I was going to fall.
You felt like you were going to fall. Yeah. Yeah, is that how we want to make our residents feel? Absolutely not. So there's a few things that we can do for this. So based on what we just did, if I can get him to lean forward, then he might get the visual of that chair, and that might help to cue him to sit. If there's a handle, I can put his hand down. So I sort of jumped ahead, but like, what do you, based on what we talked about with the vision, do you think that could play sort of a factor? So what I tell my staff is, I remind them about the vision change, and what I can suggest, other than if that doesn't work, for if they're rigid, or and so they don't want to bend forward, which can happen sometimes. What I say is, take them for a little walk, spin them around. And then try. Because if they've got binocular vision, and they've been focused on me, or they've had their social vision on, they may not have recognized that there's a chair or a bed that I'm trying to cue them to sit on. So sometimes it's just making sure that we point out that visual, and then it sort of clicks. Yeah.
I apologize for interrupting you, but there was a piece that I missed in what I was talking about, and you just brought up social vision. When folks get into,
or I can watch what's going on. It's hard to do both. Yeah.
Do you have to make some sort of compensation if their dominant side is affected by a stroke? Because we see that a lot with our residents. So somebody might be right hand dominant, but that's their weaker side from a stroke or something similar to that. Are you then using the same techniques from their stronger side, or are you still staying with their dominant side?
So absolutely. So that's something that we need to be mindful of. And again, do that dynamic assessment, and we can work to try both. Or if you notice that they compensate with their left, then we would follow. There's no hard and fast rule, right? But it depends on the individual. So, but it's important to be mindful of that, 100%. So, what we're going to do now is we're going to practice hand under hand to assist someone with eating. So this is a very important skill.
I just have one question. Would you use the same technique for someone if you're helping them to the toilet with the sitting?
Absolutely. Sure. Yeah.
Okay. I just want, thanks.
You know what the cool thing is? Would you do that again and just bend over? Would you help him bend over? And just, you drop the arm, bend over. Look where his butt is. Oh, excuse me. What's happening to his butt? His butt's going out. What's the natural inclination to do when that butt goes out? To sit down.
you made sure that my legs hit the edge of that, so that prompted me that there was something there.
Yes. Yeah, especially because I didn't tell her what I wanted her to do, and she didn't have the vision. I made sure that she felt the chair, so she knew there was something there. So I wasn't just, bending her over to, so that she could get that cue.
When you
are in the bathroom and you have to break that contact because you have to throw the pants in there and don't end up in the pants, or is that, I think that's gonna mess with your technique.
Well, we could try that. Well, maybe not
No, but really.
But who felt like they were doing that? Because the hand under hand.
And he started to continue doing it, which goes in with the.
So once I get him started, he might then be able to take over, and then I might be able to just give him the visual.
And then where will Jess go and stand? In that very private moment, where will she stand?
Well, let's hope she moves the steps away. She can't leave him.
She'll stay, she'll,
Yeah, out of his vision.
So I was showing a care partner this afternoon, because it can't back up. We have to get as close to it as we can. And so,
Yeah.
Can I just say what I heard here? Practice.
Yes. Yes. Do you know how long you need to practice before it will start to feel comfortable?
That's a good point.
4 to 6 weeks. 4 to 6 weeks until it becomes comfortable and habitual. So it is going to feel awkward at first, and that's why we want you to practice it here. Practice it as much as you can with each other, with folks that are receptive to it, so that you are comfortable in those. I mean, people with dementia are very forgiving, so if we screw up, it's okay. Uh-ohs lead to ahas. But if you are feeling that it's very uncomfortable and you're not comfortable experimenting with somebody who has dementia, which, I mean, it's okay to do, but practice with somebody else until you get comfortable. And let's practice to something that's a hard skill, a small task manipulation, or fine motor. How often do you think anyone brushes their teeth with their non-dominant hand? Or eats with their non-dominant hand? I see a lot of head shaking. Yeah, so is that going to be comfortable for them? Is it going to feel natural? No. So this is where it's really important to know what their dominant side is, and if they've had to compensate for injury or stroke, so that we can play around to figure out what is going to be the best option for that person. Can I get you to scoot up to the table, Matt? So what we're going to do is we're going to have the person living with dementia here. I'm sorry, Matt. We're going to have them sit up at the table like they normally would. And what we're going to need to do is we're going to need to scooch up real close and sort of straddle a little bit here so that we can set it up to be comfortable for them. Because if I'm over here and coming from here, does he normally do this?
No.
So is it going to feel natural to come from this angle?
it's not gonna stay at the front.
So we need to get where we can be in their midline and get it set up. And what I'm going to have you guys do is do without first. So with your non-dominant hand, I want you to make a monocle, close that eye, and then go ahead and
I wanted to open the other.
so try it without. I meant without hand under hand. So get yourself set up. Get into that hand under hand. Get your applesauce. Yep. Takes lots of practice. And you're going to kind of exaggerate the soup and put it to their mouth. And if you notice, I've got my hand here providing pressure on the shoulder proprioception is when we put pressure on a joint and it stabilizes and it tricks his brain into feeling like there's not as much going on as there is, and so he's able to tolerate a lot more. Because there's a lot of movement going on out here, but this sort of stabilizes it, and it doesn't feel like it's quite as busy. So you can provide this proprioception on the shoulder. It's okay. Or we can reach underneath and hold the applesauce or the plate or the bowl, and we can provide that proprioception at the elbow joint and do the same. So I want you to try it. So I want you to try it on the non-dominant side first, and try it without hand under hand, and then with hand under hand, and then switch.
Switch sides or switch partners?
Switch sides, and then switch partners.
So you do non-dominant, dominant, then switch partners, non-dominant, dominant.
So